the risk of the weight loss surgery, the gastric bypass, is the same risk these days as having your gallbladder removed. That's the same amount of risk that you have. And that's not me saying, this is looking at the national database, 60,000 more people. They looked at the risks. So the risk of having gastric bypass surgery these days is the same as having a gallbladder removed. Okay. So, and afterwards, you do much better because the heart gets better, the diabetes gets better, cancer rate goes down. So the risk, every surgery has risks. So I'm going to give you that disclaimer. There's long things, everything, all these things that could happen. Bleeding with any surgery is possible. Small incisions, risk is small, but could happen. Infection, same thing. Smaller incisions, less risk. Same thing with a hernia. Theoretically, we can injure anything on the inside. Obviously, we don't, but I have to give you that disclaimer. We talked about the leaks, that you may need another surgery, sepsis, peritonitis. As I told you, the risk is all very small. I haven't had a leak in regular gastric bypass for years. If someone has second or third surgeries because of previous one, then it's a different story. We haven't talked about blood clots. So anytime a patient goes for surgery, not just overweight or not just a bypass, any surgery, this is a higher risk situation for blood clots. Blood clots develop when people don't move for a period of time. And they can happen outside the surgery, just out of the blue, when you fly an airplane, when you sit at your desk for 8 hours, anytime. So surgery is a little higher risk situation. Being overweight puts you at a higher risk. Being a smoker puts you at a higher risk. Taking hormone replacements puts you at a higher risk. So all these kind of things are riskier situations. So what we do to prevent these risks is, number one is we ask everybody to stop smoking 2 months before surgery. So no smoking 2 months before surgery. For that very reason, blood clots. Second thing is we ask women to stop hormone replacements, estrogen. And that could be for birth control, or that could be if you had a hysterectomy, menopause, other reasons. We ask you to stop birth control. If IUD is usually okay. IUD is okay. Depo-Vera shots, you have to stop 3 months before. The implant is okay. You can start the birth control. You should actually start the birth control right out when you come back out of the hospital again. Okay, because we don't want you to get pregnant. And we'll come to that later. Then when you come to the hospital day of surgery, we're going to give you a little injection in your stomach, which is a blood thinner, and you're going to get that injection as long as you're in the hospital. If someone has had a history of blood clots in the past, or has a family member with blood clots, or any other risk factors, we sometimes actually keep giving you that blood thinner, that injection for 4 weeks after surgery. And it's a special personal situation. We'll talk about this when you come to the office. The other thing that we do is during surgeries, we're going to give you a stocking, a plastic stocking around your leg that squeezes throughout the surgery and as long as you're in the hospital. And the most important thing is we're going to make you walk after surgery. You're going to walk and walk and walk. So even when you get home, there's no reason to lie in bed. Okay? We don't want you to lie in bed. We want you up and about. Go outside, go up in your house, don't lie in bed. Because that's when you get blood clots or pneumonia, all kinds of bad things. So at home, we always say, walk, 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 sip, sip, sip. Right? That's the big things. So with that, we've been pretty good with the blood clots, but it could happen. The risk of blood clots in the sleeve is maybe a little bit higher than for the bypass. Again, we're talking tiny risk, but it's there. We talked about bowel blockages, reflux. That's one of the things that actually is typical for this, not typical, it could happen more often in the sleeve. It's called that people get acid reflux, particularly if someone has had a lot of acid reflux or a hiatal hernia before. The sleeve may not be a great operation at that point. So the bypass is better in that circumstance, even to the point that the sleeve has to be switched over to a gastric bypass. And I've had to do this twice so far. Low blood sugar, that's something that can happen after gastric bypass, even years later. Most of the time it has to do with what people eat, how they eat, and we can regulate that. And sometimes you need medications to help with that. We talked about too much scar tissue building, where the connections are, and that needs to be stretched. that is something that happens within the first 6 weeks after surgery. This is not a long-term problem. And then death, obviously with any surgery there's a risk of dying. The risk is very small, the gastric bypass or the sleeve surgery, but I gotta tell you about it. Vitamin deficiencies, we talked about those. Hair loss. Everybody who loses everybody who loses weight quickly with either diet or surgery or any other ways, that person will have some hair loss. The hair will fall out a little bit, will thin out. That starts about 3 to 4 months after surgery, lasts for 3 to 4 months, and then the hair will grow back. Okay, so that's something that happens. There's nothing we can do about it really. Some people say if you take biotin 2 months before surgery already starting, you may prevent it, you may help it, but there's no real study that has shown that. Some people have nausea or vomiting temporarily, usually goes away. Sometimes we have to help a little bit with medications, but most of the time it goes away. We talked about stomach ulcers. Excessive weight loss is rare. That is basically a psychological problem. Someone becomes anorectic at that time. Same thing with other psychiatric complications. Heart, lung, nerve can happen with any surgery. Gallstones, that's a more typical thing. If someone loses weight fast, again, with or without surgery, doesn't matter, you're at higher risk of getting gallstones. With kidney stones, talk to your doctor because you can't drink much, you may be at higher risk of getting kidney stones. So you really got to push the liquids. Same thing with gout, you got to let us know so we can give you preventative medications. Again, if you have any complications, you obviously can end up in intensive care unit and so forth. Now, your bowels. Most people initially after surgery may have some irregular bowel movements, constipation, diarrhea. That kind of goes away. Most people, when you take the diet that we recommend, which is more protein, less sugar, less fat, if you take that kind of diet, you're going to get constipated because a high protein diet gets you constipated. If you've been constipated before, unfortunately, it'll get worse. You can take any laxatives you want, and you may have to just take them from the beginning because that may happen. It's not something that we can avoid, unfortunately. Now, the last thing is dumping syndrome. Okay, this is not something that has to do with your bowels. Dumping syndrome is when a person with a gastric bypass, and mostly gastric bypass, if you eat something real sugary or real fat, like butter or maybe even bacon or something like this, if you eat that, that person may get deadly sick, may feel like they're dying. Okay? They feel horrible, they're lightheaded, they're sweaty, they're nauseated, they think their last minute has come. And it lasts for an hour and a half, then it goes away. It's just a feeling. It's really not a dangerous thing to have. It's a feeling, but it's such a terrible feeling that it cures you of your sweet tooth. Okay? This is a great thing for you to happen. We love it because it helps you get off of it. It's fair punishment because you weren't supposed to eat that in the first place. This is nowhere in our diet instructions. Okay? And some people actually pick the gastric bypass because they know that they have a sweet tooth, and this is the only way they know they can get rid of it. It doesn't happen to everybody. If you are smart, you kind of listen to me and think, well, he's done 2,000 surgeries, he kind of knows what he's talking about. But if you want to try it yourself and suffer, it's up to you. Okay, so that's about the dumping syndrome. So look forward to it. It's going to be very good for you. Many of you have done your own research. You've talked to people about the surgeries, about their experiences, and you've heard a lot of myths. So I would like to go through some of these myths and tell you what the real truth is. A myth is that the surgery, weight loss surgery, has a lot of complications. I've showed you in the previous slides that actually weight loss surgery has similar complications to gallbladder surgery in people with diabetes who are already a little sicker. Some people are afraid that they're going to be too thin after weight loss surgery. That's really not the truth either. Unfortunately, our body actually stops losing weight far before you really want your body to stop. So people do not look too thin. Now the myth is that you have to lose weight before surgery. No, truth is you do not have to lose any weight unless Dr. Blumenthal or I tell you so. But you do not have to lose weight before you even come to the office. Myth is that you need to crush your medications after surgery. Truth is you do not have to crush your medications. You can take normal pills right after surgery. Myth is that you will never be able to eat normal again or that you will not be able to socialize again. Truth is you will eat normal food. Maybe not all the foods that are out there, but you will eat completely normal foods. You can go to restaurants, you can go to family gatherings, you can eat at home, you can buy foods on the outside. But this will be different food. This will be healthy food. This will be food that's good for you, and it will keep your weight off. That's the only difference. But these foods are around everywhere. Myth is you will not be able to drink carbonated beverages. Truth is, yeah, for the first month, you should probably not drink those because the bubbles can actually give you discomfort. But after a month, you start slow, you let the drinks get a little more bubbles, and over time, you will be able to drink normal carbonated beverages. Again, not with calories though. Myth is you cannot drink coffee anymore. Truth is, after about a month, you can hydrate yourself well enough that you can drink coffee again. That can be decaf coffee or that can be caffeinated coffee. There's no difference. It's just all about hydration. And there will be more myths and questions coming up. But we're here for you. We help you to debunk all these myths. We help you to get you through this and tell you what the truth is.